नमस्कार, मैं हूं हिना खान और आज हम एक ऐसी सच्चाई पर बात करने जा रहे हैं जो महिलाओं की जिंदगी बदल कर रख देती है। ब्रेस्ट कैंसर। मैं खुद ब्रेस्ट कैंसर से गुजरी हूं, इसलिए जानती हूं कि डर कैसा लगता है, कैसे कैसे सवाल दिमाग में आते हैं और वो पल जब लगता है कि कुछ समझ नहीं आता है, वक्त जैसे थम सा गया है। लेकिन मैं ये भी जानती हूं कि एक छोटी सी आदत, एक छोटा सा कदम जिंदगी बचा सकता है। ब्रेस्ट कैंसर का सबसे बड़ा इलाज है उसे शुरू में पकड़ना, और वो हम खुद कर सकते हैं। सिर्फ 2 हाथ, 3 मिनट और बस एक इजीएस्ट एग्जाम अपने आप के लिए। इसलिए मैं यहां हूं आपके साथ और उन एक्सपर्ट ऑन्कोलॉजिस्ट के साथ जो हर दिन इस लड़ाई में महिलाओं का साथ देते हैं। हमारा मकसद है खामोशी तोड़ना, डर कम करना और हर एक को ये याद दिलाना, अपनी सुरक्षा आपके अपने हाथ में है। I would like to take the pleasure to introduce Dr. Tejinder Singh. Welcome, sir. Welcome you here. And I'm so happy to see you here. So much to learn from you. And I'm going to take a lot of energy, good energy, positive energy, strength from you because we all need it. आप सबका बहुत 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 स्वागत है। हम चाहते हैं कि आज के एपिसोड में आप हमें समझाएं ब्रेस्ट कैंसर के बारे में, और सबसे जरूरी 2 हाथ, 3 मिनट और एक इजीएस्ट एग्जाम का क्या महत्व है। तो चलिए इस एपिसोड में बेसिक्स के साथ स्टार्ट करते हैं। मैं आपसे पूछना चाहूंगी डॉक्टर तेजिंदर, सर, यू आर वन ऑफ द की डॉक्टर्स इन इंडिया, सीनियर एंड वेल नोन इन इंडियन ऑन्कोलॉजी, treating so many breast cancer patients. Why do you think breast cancer incidence rising in India, especially among young women?
So I think it's very important question when we discuss this point. And like in India, when we talk about the lifetime risk, one in 28 females, they're going to get breast cancer. So that incidence is increasing. And more so in India, I think what we are seeing is that younger ladies, when I'm talking about less than 50 years, our majority mean incidence is younger ladies less than 49 years. और उसके reason multiple हैं. सबसे बड़ा reason I think lifestyle है, हमारा diet है, और एक reproductive factors हम लोग बोलते हैं. Because now the tendency is that delayed, I will put it like that, societal factors where ladies are getting married late, having first baby at the age after 30 years, and we cannot go back to the old stream where multiple childbirths were there. But yes, एक और important factor है breastfeeding. Most of the ladies right now, the average duration they go for the breastfeeding is hardly 3-4 months. Concept of pumps are there, but somewhere down the line, the overall duration of breastfeeding has come down. There are other factors also which are contributing, like the
Genetics.
genetic factors.
Yeah.
Around 15% patient ladies, they will have genetic history, but incidence is increasing, and incidence of stage 3, stage 4 cancer is more in this young population, mainly because of awareness. It's a misconception very commonly which is propagated, is that young people will not get breast cancer. In India, the youngest incidence of breast cancer is at the age of 14 years.
14 years.
14 years.
14 साल की उम्र में.
So I think no one is, everyone is at risk, and day by day our probability of getting a breast cancer is increasing because of these factors.
जो 15% की जो महिलाएं हैं, उनकी जेनेटिक रीजंस हैं, डू यू थिंक उसमें भी ये रीजंस काउंट होते हैं?
Yes,
रिप्रोडक्टिव
yes,
रीजंस
yes.
एंड लाइफस्टाइल.
Yeah. So these 15% who have genetic history, we put it genetic into a very simple concept like first degree or second degree. And it means that your own siblings
Yeah.
and your parents, like mothers. So these are one of the, when you tend to see these patients, they need to become more aware. There, you cannot prevent a breast cancer. Only thing, you can detect it early. That's a concept in this genetic population. So right now we have lots of tests available, like we do genetic testing like BRCA1 and 2, and which help us in defining which population they will get, the breast cancer probability is high. So I think genetic predisposition is there. Your goal should be early detection.
Early detection.
Because there's a lot of concept which is there in the market, is that, there's something called cancer prevention diet. cancer healing diet, cancer curing diet. These are all misconceptions. There is no diet which will define or try
It can
to.
help.
It can help you in improving your own immunity.
Yeah. Yeah.
The word is, like obesity is why I'm telling lifestyle. Obesity is increasing in younger females. Our diet is becoming more westernized. We are all eating more of carbohydrates. It does help. If you go back to our own routine Indian food, I think the issue, we are going towards a millet-based diet. So I think we will go over, but I think you require awareness that lifestyle is important factor. And one more thing, I feel I always go on telling alcohol limit.
I knew you'll say that.
And also, smoking is a very big factor. And I think important point is the breastfeeding. I think day by day, most of the females, they are going for less amount of breastfeed. 3
Breastfeeding.
months, 4 months, because of the job and other thing. We tend never to go for too much of. I remember my mother, she fed me for nearly 1.5 years.
So what do you think is the right time, right amount of time for a woman to breastfeed her child?
So ideally, minimum 6 months to 1 year.
Minimum 6
Minimum
months
6
to 1
months to
year.
1 year, which government is also trying to help us. Maternity leaves is going for 6 months, but most of the ladies, if you see in corporate, no, they will do is they'll utilize the leave prior to the getting delivery. So I think we need to extend our time of breastfeeding to at least 1 year, and we need to give them. Corporate should be helping them in giving them more leaves over there.
दो चीजें मुझे समझ में आई हैं इस सवाल से। पहली ये जो आपने बोला कि लाइफस्टाइल इज वन ऑफ द मेजर रीजंस, एंड दूसरी ये जिनको जेनेटिक है उनके लिए एक चीज, इफ दे गेट टेस्टेड, इट्स नॉट नेसेसरी दे हैव टू हैव अ कैंसर
Yes.
to get tested. Like I didn't know that I have I am also BRCA1 positive. I didn't know about it. But a person can get tested, preventive care में जा सकते हैं, and then they can look after their bodies,
yes.
right? That is one point. And दूसरा, this breastfeeding for a longer period of time for
Agreed.
women. ये एक बहुत ही महत्वपूर्ण point है, मुझे लगता है कि जो महिलाओं को ध्यान देना चाहिए जिस बात पे, कि ना कि सिर्फ I think you also said कि reproductive reasons are that,
Yes.
early pregnancies,
Yes.
right? Late pregnancies lead to
Late pregnancy are supposed to be not good. Especially, there is a factor very clearly mentioned that when you are going to have a first childbirth after the age of 30 years, it's itself is a relative risk of increasing the breast cancer. And like what you said is very right. All these factors, especially familial genetic factors,
Yeah.
what happens in this that we need a good counselor. We
Yeah,
need a
yeah,
good
yeah,
counselor
absolutely.
to help you in understanding, yes, why you need to do testing. You cannot prevent it, but you can detect it early, especially in
You
this
can detect it early because you'll start testing very frequently.
So that is what is happening. So things are changing, I felt, for the better, but our population is also increasing. That's the reason
जी,
why
जी.
I feel somewhere down the line, the population increase is also looking at the increase in the number of patients. In the young.
Thank you, doctor. Thank you for this insightful answer. सेल्फ ब्रेस्ट एग्जाम सिर्फ 3 मिनट में ब्रेस्ट कैंसर डिटेक्ट कर सकता है। जल्दी डिटेक्ट होने से ब्रेस्ट कैंसर का ट्रीटमेंट और क्योर पॉसिबल है। इसलिए ये कैंपेन कह रहा है 2 हाथ 3 मिनट, एक इजीएस्ट एग्जाम। मैं चाहती हूं कि हर एक औरत अपने 2 हाथ से 3 मिनट निकाले और ये आसान सा ब्रेस्ट सेल्फ चेक एग्जाम करे। Moving on, Dr. Tejinder, I have a question. How do you address the stigma that still surrounds breast cancer in many families?
So I put this stigma into 3 areas. One is for the patient itself, second is the family, and the third is the whole community. So, stigma doesn't come from the community itself.
जी.
Stigma comes from the like misconception of the patient itself,
जी.
family also.
Your own partner.
Partner. Yeah, that's very
सबसे
important. Yes, yes.
Your own partner.
Yeah. So, and second important thing is that, this all this stigma needs to be countered by one important thing: education and good awareness. And they need to open up. Yesterday, I remember one family came because since old lady, she is 64 years, she had breast cancer. The the daughter and the son-in-law were not sharing the kitchen with them because they had a misconception that it is nothing but a contagious disease. It's not a COVID where it is going to pass on from one to.
Exactly.
So that stigma, what you said,
Oh
is
my God.
not lying. It becomes
And
very
they knew
difficult.
it is cancer,
They knew it is cancer. Then
but they thought it's contagious.
they thought it is contagious. They never
Oh
met
my God.
they never made an effort for the grandkids to meet the grandparents. And it's so painful for the grandparents also. So the stigma, I felt, not only, and second, everything has to be solved through only one thing: a good education. They need to open up. You need to open up. You need to get educated. You need to create awareness. And I think the one which has happened very nicely is the survivor group. I run a survivor group. Almost every center has got a very good survivor group where they share their experiences, stories, and these stories need to be, they will give you some basic concept कि सुबह उल्टी आती है तो करना क्या है.
करना क्या है?
And it's the survivors, they help you a lot. We have survivors like who had been diagnosed as BRCA mutant positive. She goes and meets a family. So a good education, eh, they need to open up to a clinician directly, the family itself, and the community. Basically, we need to create a awareness that it's not a contagious disease. There are a lot of misconceptions about the disease. It's curable. The most important thing is that
It is
people
curable.
have a concept that when you go for chemotherapy, something is bad happening, your stage is upstage, another thing. Right now, Vanita has opened up very nicely that not every patient requires chemotherapy also.
Yes, absolutely.
Right now, there are so many new things which have come up,
Drugs, yeah,
drugs available.
yeah.
And talking about the cost has also come
Yeah,
down. I think
yeah.
it's not like it's a disease of the rich, which he was telling. No,
Yeah.
there are people who are able to afford it. A lot of things have advanced. So stigma is not only lying with only getting a disease. Stigma is lying with only one more important thing: what is going to happen to me and the cost. I think the reason why many of the ladies are coming very late to a clinician is that they feel very scared कि मैं अपने बच्चे को बताऊंगी तो उसको 4-5 लाख का खर्चा आएगा. That concept is there. I will not getting cured. They will come late. I will have to always take chemotherapy, injection, radiation. No, not always.
Not necessary.
Not necessary.
Not necessary.
But what you said is very right. Partners
plays a
very
very
important role.
important
And
role.
I felt the family matters a lot in the treatment. And I do not know, the community matters, but most important thing is the family and your own kids and others. They are the one who are going to take you to the next step.
Since I was diagnosed with stage 3 triple negative breast cancer, so my chemotherapies were very harsh, especially the first one, carbo and paclitaxel. I still have the side effects. So what kept me going was the love I received from my family and my husband is irreplaceable. And I have done everything while my chemos were going on. Everything. I did not shy away from going out. I did not shy away from eating out. There were days, there were very bad days, but there were amazing days too, where I felt absolutely normal. 2-3 दिन हैं
Yes.
शुरू के जो
Yes.
बड़े सख्त होते हैं, उसके बाद आप
Hats off to you. I'll just tell you, the way what you're telling is very important. I was just discussing with Dr. Vanita also. The kind of fatigue happens post chemotherapy, the kind of emotional support you require during that time, the hormonal changes which happen during
जी.
the chemotherapy. For उस सबका जोड़ family ही है.
family hai,
Not
love.
the medicines.
It's not the medicine.
It's not the
medicine.
medicine.
It's the love.
Everything is every root answer is family. You need a good family. I won't let's say good. You need a family.
You need
to
a
take
family.
care of you.
Yeah, you need
So
a lot of
yes,
love
yes,
around you.
yes. But
You need to feel loved.
yeah, agreed.
Yeah.
And the stigma basically happens because of nothing but misconception, nothing else. I feel that every problem has a solution.
Every problem
Has a solution.
Yeah.
And we look into, breast cancer is one disease where even if you have a stage 4, they have a survival. There are people who are living for last 15-20 years also. And with the tablets, which hardly cause anything. So it's a misconception which is just going around. It's only awareness is going to something bring.
And I have also, this is my personal experience, ये जो बोलते हैं ना disease of the rich and everything, Naseeb plays a very important part. sometimes a simple drug works in a stage 4 patient,
Yes.
and that simple drug doesn't work in stage 1 patient.
Mm.
So somewhere I feel destiny also plays a very, very important part. So why stress then? Yeah, just chill and do your things. Yeah, अब जब अपने हाथ में ही नहीं है, दवाई लो, अपना सब करो, exercise करो, खुश रहो.
And mind plays a lot of role, like what you said, that after 3-4 days after the chemotherapy, you used to go back and be regular in the
Gee,
things.
I used to exercise.
Yes. And it's always a concept कि होता है family को कि if you're taking chemotherapy, let them take lot of rest. No. More they keep their muscle toned, I felt it matters a lot.
I remember
Recovery is very good.
Dr. Advani, Dr. Suresh Advani telling me, you've taken chemo, it's your first day, go walk 5 kilometers. So he used to tell me, and yesterday also I met him, he used to always tell me, walk 5 kilometers a day, even in chemotherapy. So ये क्या था ना, हम खुद अरे बाप रे, कीमो अगेन इज लाइक कीमो से लोग इतना ज्यादा डर जाते हैं कि है, मैं नहीं बोल रही हूँ आसान है, इट्स हार्ड, इट्स नॉट इम्पॉसिबल.
Yeah, absolutely.
एक और पहलू है जो हमेशा पेशेंट्स के दिमाग में होता है, क्या मेरी फैमिली हिस्ट्री से मुझे भी रिस्क ज्यादा है? और ये जेनेटिक टेस्टिंग और प्रिवेंशन का सवाल और भी बड़ा बन जाता है. इसलिए मुझे ये पूछना है, स्पेशली फ्रॉम डॉक्टर तेजिंदर, हाउ डू यू encourage women to opt for preventive checkups when they feel perfectly healthy? Also, how can women with family history reduce their risks?
So preventive checkup, especially when you talk about especially looking at the breast part only, breast health only, we encourage them to do the mammography after a certain age. And mainly important thing is to go ahead with the self-examination,
Ji.
more awareness and other things. And this is something which is important. Even with the people who have a family history, prone patients, we encourage them to do the genetic testing. Now,
Ji.
genetic testing doesn't cost too much. It just costs 12,000 rupees to get your testing done. And it is not required that you need to put a needle in the breast to do it. You can just do a blood test and get it
Yeah,
tested.
simple blood test.
Simple blood test.
Yeah.
And this genetic testing helps you in defining many things.
Many
It
things.
helps you in
Had I
telling.
known it
Yeah,
before.
yeah. And it is not always a rule that, if you get it, your sister is going to get it also.
Sometimes it skips a generation.
Sometimes it just skips a generation.
Yeah.
And it helps you in defining that, there are, like I said, you need to be counseled for it. If anyone gets positive for a BRCA mutation,
Ji.
then requires a help. You need a help of not only clinicians, you need a help of a counselors
Counselor.
also, because your next step is dependent on it.
Dependent on it.
So whether you need to do some kind of risk reduction surgeries, whether you need to do kind of mastectomy, it's
That takes a toll.
It
on
takes
a
a toll.
woman.
It takes a toll, and even here, there also a lot of refinement has come now. Skin sparing, nipple sparing surgeries have come up about there.
Ji.
But I think it matters. And second important concept which always comes in the mind is that, if you get a BRCA mutation,
Ji.
then the probability of getting pregnant is impossible. It's not like that.
It's not like that. Every problem has a solution.
Yeah.
Okay. आज हमने डॉक्टर्स से समझा और सर्वाइवर से सुना कि ब्रेस्ट कैंसर एक ऐसी बीमारी है जिसे अगर हम शुरू में पकड़ लें तो उसका इलाज आसान हो जाता है और जिंदगी बचाई जा सकती है. 2 हाथ, 3 मिनट और एक आसान सा एग्जाम और खुद की रक्षा.